Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing. You never asked the question why it's happening. Why is this happening? Today, for the first time in 20 years, we learned that infant mortality has increased in our country. It's not because I came in here. It's because of what happened during the Biden administration that we're going to end.
I'm going to let Senator...
What is it that you're doing to address the effectiveness and the outcomes of our health care expenditures as opposed to just throwing more money at the problem?
Yeah, I mean, throwing money at the problem does not work. We spend 2 to 3 times per capita what European nations spend on health care, and we have the worst health outcomes. We're 79th in health outcomes globally. Over the past 20 years, we've lost, or 30 years, we've lost 6 years to Europe in terms of longevity. So our lifespan was even with Europe's, now at 6 years behind. As I remarked to Chairman Wyden this morning, or Minority Leader Biden, today we got new data that showed that infant mortality has increased in this country in 2024 for the first time in 20 years. Diabetes has gone up 98% in 20 years. Nobody's doing anything about it. CDC's job was to make sure that this didn't happen. And what we're going to do is reorganize CDC, but also we've already righted the ship at NIH, at FDA, at CMS. And we are going to end the chronic disease epidemic. We are devoting thousands of studies. We're going to devote to identifying the causes, and we're eliminating them. And we're already starting. We're not waiting for everything to come in. We are starting now. We're doing this with food dyes, with grass standards, with dietary guidelines. We're going to get better food and better health to the American public because it's chronic disease that is bankrupting us and destroying our national security.
Why have you acted behind closed doors to overrule scientists and limit the freedom of parents to choose the COVID vaccine for their children? Why have you done that?
For the COVID vaccine, I was removed by FDA because there was the industry.
No, it was behind closed doors.
No, it's not.
And scientists who said they wanted to brief you on the science, scientists who wanted to understand why the FDA, why you unilaterally changed the parameters for giving vaccines, making it possible now, to Senator Cassidy's colleagues' points, that they're going to have to go off-label.
This is crazy talk. You're just making stuff up.
To prescribe a vaccine for children. I'm not making things up. Do you know how the FDA approval process works and what happens?
I know exactly.
Do you know what an off-label prescription is?
I know exactly how it works. I know exactly how it works.
So why behind closed doors?
It's not behind closed doors. The industry makes the studies, and they could not provide a study that said that it is effective for healthy kids.
So when have you produced the data that you relied on and that this FDA relied on to change those parameters? You did it behind closed doors.
No, the data is all public.
Now parents who decide that they do want their children to have
You're just making stuff up, Senator.
I'm not making stuff up.
You're just making stuff up.
You know, sometimes when you make an accusation, it's kind of a confession, Mr. Kennedy. So let's just settle with this. So here's what's going to happen. To Senator Warner's point, to the parents who are concerned all around the country, to people who want to get the COVID vaccine this fall, even if they're under 65, because the boosters have worked, there's been much less serious disease, people do not have the same level of threat and risk from COVID that they used to because of these vaccines. People who want to exercise their freedom of choice are being denied that.
No, they aren't. Everybody can get the vaccine.
Because you are citing data that you won't produce to the public.
You're just
and
making things up. You're making things up to scare people, and it's a lie.
With respect, I do not think I'm the one making things up.
Thank you, Mr. Chair. Right now, Senator.
So could you explain what steps you're going to be taking to ensure vaccine guidance is clear, evidence-based, and trustworthy?
Yeah, we're going to make it clear, evidence-based, and trustworthy for the first time in history. Right now, you know, when I was a kid, I got 3 vaccines. I was fully compliant. Today's children have to get between 69 and 92 vaccines in order to be fully compliant, between maternity and 18 years. Only one of those 19 vaccines, 92 doses, only one of those vaccines has ever been tested against an inert placebo. And what we're doing now is any new vaccine that before it's approved and licensed will have to demonstrate safety against an inert placebo, and we're going to go back and do observational studies on the existing vaccines to see if they're linked to any of these chronic disease epidemics so that people can understand the risk profile of those products and make good assessments for their own health.
Here's the facts. The VAERS system that was touted in October of 2020, this great safety surveillance system on COVID, a few months later when they didn't like the results, they started denigrating their own system. But VAERS shows that there have been 38,742 deaths reported on VAERS worldwide associated with the COVID vaccine. 38,742. 9,252 of those deaths occurred on the day of vaccination within 1 or 2 days. Again, I agree with you. Nobody knows how many COVID deaths were because the information was completely corrupted. Nobody knows how many lives were saved by the COVID. Again, I think most people, okay, if you're vulnerable, raise your antibodies, reverse severity, fine. There's not any good study on that. There's just information out there, just claims being made. This is hard evidence. And certainly what I've been advocating for are the injection injured, the childhood vaccine injured. We're going to be holding a hearing next Tuesday on a study done by a high-integrity healthcare facility that shows, that actually looked at vaccinated versus unvaccinated, very high-quality study. I'm not going to steal the thunder of Aaron Sear, who's going to be testifying on this. I think you're aware of this study that shows the vaccinated population far more prone to chronic illness than people completely unexposed to vaccines. That is just one example of how science has been corrupted by the way, the study was conducted, and when they conducted this, oh no, no matter what the results are, we're going to release this. They got the results in 2000. It is yet to be released. We're going to enter that in the record on Tuesday. Do you want to just talk about what you've witnessed in terms of the capture of the agencies that you're now in charge of, the corruption of science, which I believe you just said, that is almost your number one goal, right, is try to bring integrity and credibility back to science, which has been corrupted by the people who pay for it, by federal health agencies being captured by pharmaceutical industries, by big pharma, by big food. I want to give you, I'm sorry, just the last minute to, first of all, defend yourself, but talk about the corruption of science that you're having to deal with and trying to correct.
Yeah, I mean, I'll just tell you one example, and I could sit here and give you thousands. But in 2002, CDC did an internal study of Atlanta and Fulton County, Georgia children, and looked at children who got the MMR vaccine on time and compared those to kids who got them later. So in other words, kids who got them before 36 months and kids who got them afterward. The data from that study showed that black boys who got the vaccine on time had a 260% greater chance of getting an autism diagnosis than children who waited. The chief scientist on that, Dr. William Thompson, the senior vaccine safety scientist at CDC, was ordered to come into a room with 4 other co-authors by his boss, Frank DiStefano, who's the head of the immunization safety branch, and ordered to destroy that data. And then they published it without that fact. So you know that story, I know that story, and you know of hundreds of stories like that. It happens all the time. We are being lied to by these agencies, and we're going to change that right now.
30 seconds left. Talk for a moment on how you can better arm parents with information on the harmful side effects of overprescribing these stimulant drugs.
I mean, one of the problems, Senator, is that, we now have 1 out of every 5 kids on these drugs and the antidepressants, even more. And we know very little about the long-term impacts because NIH and CDC have been asleep at the wheel. Right now, we are doing those studies. We're doing extensive studies so that we can warn parents and so that we can force the companies to put labels on their products. And, we'll do whatever we can to show that, just to get data out to the public. That's really what our function is. And to show what the long-term impact of some of these drugs is. Are we actually preventing suicide or are we creating more suicide? And that's something that we don't know the answer to, which is, how did these drugs become so common in our society without us even knowing the answer to those questions? That is malpractice at these agencies, and that is the malpractice that I am going to fix.
Thank you.
Thank you. Senator Warren.
Thank you, Mr. Chairman. So last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, "If vaccines are working for somebody, I'm not going to take them away." No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is everyone who wants it. That was your promise, Mr. Kennedy,
I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access to
it depends on the It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with measles,
you want me to recommend every product in the world so that without any clinical trial data?
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines.
You are taking that.
Now, when I listen, what I hear you say is that, look, vaccines are drugs. We need a measured response and a measured, when do we use this? It's interesting that the United States has put age 65 and older for COVID vaccine. UK has chosen 75 and France 80. Obviously, scientists disagree exactly when that should or shouldn't be. You know, hepatitis B vaccine, it makes no sense to me. I've only delivered 5,000 babies, but we do a hepatitis test on every mom. By the time she delivers that baby, I know her pretty well. And if she doesn't have any risk factors, if she's not an IV drug abuser, if she's in a stable monogamous relationship, nobody at home has hepatitis, I don't know, I don't see the benefit myself in that hepatitis vaccine. Everyone's eligible for it, everyone can get it, and my pediatricians don't always agree with me. And no, I'm not saying if you don't know the hepatitis status of that patient, they shouldn't get it. I'm not saying if this person's had no prenatal care, that puts them at risk for hepatitis. Can you just speak a little bit, when you talk about transparency, and trying to empower and make vaccines available, these should be treated just like a medication.
Yeah, I mean, you know, I say I'm not anti-vaccine. Saying I'm anti-vaccine is like saying I'm anti-medicine. Well, I'm pro-medicine, but I understand some medicines harm people. Some of them have risks. Some of them have benefits that outweigh those risks for certain populations, and the same is true with vaccines. And we don't understand the risk profile because vaccines are the only medical intervention, medical device, or pharmaceutical drug that are exempt from pre-licensing safety studies. And so there are 2 hepatitis vaccines, and one of them had a safety study that lasted for 4 days on 143 kids for a product that's going to be given to 76 million kids. Yeah. The risk profile prior to the introduction of the vaccine, the risk of a baby dying from hepatitis B was 1 in 7 million. That means you need to give 7 million hepatitis B vaccines to prevent 1 death if you're going to give 7 million.
So, Mr. Secretary, and I guess before the press labels me wrong, I'm not anti-vax either. I think MMR has been a great vaccine. The DPT's been a great vaccine. Polio's been a great vaccine. Smallpox. So there are great, but it's the measured approach that we're after, the transparency. You're trying to empower parents here. What I feel the difference is, sometimes my friends across the aisle feel like there's a one-size-fits-all, that they should be telling parents what to do. And what you and I are fighting for is we want to empower parents to make these decisions. I want to talk about morbidity and mortality of COVID for just a second. It is so true that 2 things can be true, and I don't understand why, just the rabbit hole some of my colleagues are going down. There's a big difference. When I was out there practicing, doing volunteer work, I was so confused myself on the numbers. People dying with COVID versus from COVID. And we still don't have that message, and I think that's what I hear you saying as well. How many people died from COVID versus with COVID is a different answer. The situation today is so different when this monster virus was made in a laboratory in Wuhan, China, and none of us had ever seen this virus, and we had no immunity to it. But today, every American's had COVID a dozen times probably, and we built up immunity. I think that's why both things are true. It was a miracle. Warp speed was a miracle, what President Trump and his team did, and it saved millions of lives most likely. But it's also true that it probably killed some people. Like most vaccines do, there is a death rate associated. So both things are true. Anything else you want to clear up on the morbidity, mortality of COVID and COVID vaccines?
Well, I think you just cleared it up. You know, the COVID vaccine was critical. President Trump's leadership got it to us when our society was locked down. It allowed us to open up. It was, as I said, perfectly matched to a virus that was new in the experience of humanity. And so it was a miracle. Right now, we're dealing with completely different circumstances, where the virus has mutated, where it's much less dangerous, where there's a lot of natural immunity and herd immunity. And so the calculus is different, and it's complicated. And, you know, if you just want to turn everything into a soundbite, it makes it, you know, you can't have a grown-up conversation. But, you know, there were more reports to VAERS, which is the only surveillance system that we have, of injuries and deaths from that vaccine than all vaccines put together in history. So we have to acknowledge that there was a cause. We acknowledge that there was a benefit. We can't quantify either one because of the data chaos at CDC, and that's all I'm saying. And they think I'm being evasive because I won't make a kind of a statement that's almost religious in nature. Did it save 1 million lives? Well, there's no data to support that. Or maybe data, you know, there's no study, that there's modeling studies, there's faulty data. I'm not going to sign on to something if I can't do it to a scientific certainty. It doesn't mean that I'm, you know, anti-vax. It just means I'm pro-science.
Thank you. I yield back.
Thank you.